Welcome to the CHOW Podcast, hosted by Animal Friends of Wyoming County, where our mission is to help care for animals held by the Wyoming County Animal Shelter and promote responsible pet care in Wyoming County. Thank you for joining us. Welcome, everyone, to the Animal Friends of Wyoming County CHOW Podcast. On this episode, we are going to talk about a very sensitive subject that's going to be very hard to emotionally go through, but it's something that we as pet owners definitely need to be in mind of. I am your host, Sam Goodell, the president of Animal Friends of Wyoming County. Before we introduce our special guest of honor, I would like to introduce my co-host for today. So we have Miss Jessie Stock-Lombardo, our CHOW coordinator. How are you doing today?
I'm great.
Good. And then we have Mr. Tom Purcell, our program director.
Program director and anything else I can try to avoid doing around here, but yeah, the list is long. Thanks for the invite.
Of course, yes. Thank you so much for coming on board, both of you. At this time of recording, it is, November 10th, 2024. Thank God we're done with the election. So, now we're just going to move on with life. I was going to give a little bit of a corny joke. I guess I'll give one now. To anyone who did not like the results of the election, life will get better. I promise you. To anyone who did like the results, life will get better. All right. So, next up, let's introduce our special guest of honor for today. We have Dr. Elizabeth Wolf of the Perry Veterinary Clinic. Dr. Wolf, welcome.
Thank you. Thanks for having me.
Yes,
I'm
and
excited to be
please tell us a little bit about yourself. So introduce yourself to our audience.
Okay. Well, my name is Dr. Liz Wolf. I have been a veterinarian at the Perry Vet Clinic since 1997. I graduated from vet school in 1995. I grew up in Pittsburgh, Pennsylvania. Went to Penn State for my undergrad. Went to Ohio State for vet school, and did a little bit of mixed animal work in Ohio for a few years, and then moved out here and did a little mixed animal work, and then started having a family and went to all small animal. I have kind of an odd experience for what made me get into veterinary medicine. I've always loved animals, but I was really into horses when I was younger. And I was at the farm one day. I was probably 9 or 10 years old, and they called for a veterinarian, and in came this woman. So we're talking like 1977. And at that point, probably 10 to 20% of veterinary schools had women in them. Now it's probably 20% are men. But at that point, not very many women went to vet school. And so in came this woman to look at this horse, and she had her little medical bag. And I was like, gosh, I could do that. I could do this. She looked at this horse, gave it an injection, and within 10 seconds, the horse reared up, ran out of its stall, and dropped down dead. But I still was like, I can do this. That didn't sway me. And then my father said, oh, Lizzie, it's going to be hard to get into vet school, so maybe you should think of something else. And I thought, all right, that's enough. That's all I needed. So I took a little bit of a circuitous route, but I did get into vet school, and and now I'm up here, and I've been up here since 1997. Wow. With the Perry Veterinary Clinic, and a little bit of mixed animal work, and now all small animal work. Took a little bit of time off to do part-time, and now I'm back full-time, and yeah, I love it. Nowhere else I'd rather be.
Awesome. You have a very nice and active family. I know you have a very nice and active lifestyle, too. Not everyone could do what you do. So what do you do outside of work that's for fun?
I like to do triathlons. I actually love to run. So I do half marathons, but I now have started dabbling more into the triathlons. I'm going to do a half Ironman in July. It will be my 4th one. And I love my dogs. They're the love of my life. So I spend a lot of time with my dogs. A lot of time outdoors, a lot of time with my dogs.
Mm-hmm.
Who are your dogs?
I have 2 Australian Shepherds. Sophie is 12 and Lucy is 3. Very active dogs to fit my active lifestyle.
Perfect.
Yes. Yeah.
Awesome. Well, I'm sorry, did you want to jump in there? No, okay. Well, I've been very blessed and privileged to be able to work alongside Dr. Wolf for the past 9, going on 10 years as of next year now. So it's been an honor, and this is a very hard and sensitive topic that we're going to be discussing in great detail today, but I couldn't have picked a better or thought of a better person than you to work with and to do this topic
you.
with. It's not easy at all for pet owners or even myself as an animal control officer when these situations happen, and to get your perspective on it will be great.
Thank you. Thank you.
So diving into that, our topic today is pet euthanasia, and whether we like it or not, as pet owners, it is part of pet ownership and responsibility that when our pets get to a certain age or there's a certain ailment that is incurable or circumstances beyond our control occur, those end of life discussions have to be made, and the only concern that we should have is how is the process and how humane it can be. And thankfully to modern medicine, there is a safe and legal and humane way to go through this.
Yes. Agreed.
So in your words, Dr. Wolf, how would you describe pet euthanasia or euthanasia in general?
Well, it's interesting. So, a lot of times when people know that I'm a veterinarian, that's the first thing they'll say is, "Oh, I wanted to be a vet, but I couldn't put animals to sleep." And even now, when I do euthanasias, people will say, "Oh, I bet this is the worst part of your job," and I understand that thought. But the truth is that it's not the worst part of my job, and it doesn't even make up 10% of my job. I would keep every animal alive forever if I could. But that's just not the case. So the fact that we have the ability to end an animal's suffering, I think is a gift. I think of it as a gift. It's something that they don't have it's not legal in most places in human medicine. And sometimes it's just an animal has reached the end and is suffering. And so we're able to end that with dignity. And I remember, it's probably been like 10 or 15 years now. And I was putting a dog to sleep and the owner said, I think the dog's name was Daisy. "Thank you, Daisy, for the wonderful 13 years of life you've given me." I feel like we get teary-eyed. And I thought, that's how we should look at it. Like that this dog gives us the years that these dogs, we think so much of ourselves, like, "Oh, I'm going to be so sad without my dog here," which we are. And those of us that are lucky enough to love an animal the way that we do are going to miss them. But also, on the flip side, we have to think, what a great however many years they've given us, and how fortunate we are to have had that bond, because some people never do.
Mm-hmm. Yeah. It's, as you said, it's the sad part of life, but it is a part of life that will happen for that's the one thing we all have in common is death, and it's. For animals, we as humans are their caregivers, their caretakers, and they look to us to make those determinations on keeping them healthy, keeping them safe from harm and fear, and even in their last stages of life.
Yep, it is definitely our responsibility, and nobody takes it lightly, myself or the owners. Mm-hmm. Nobody. I would never say it's an easy decision, but mm-hmm. It's I'm happy to be there to guide people.
Mm-hmm. Yeah. So for euthanasia, I was told by another veterinarian, and I'm curious if this would be part of your story too, is that in vet school there wasn't a class on euthanasia, or at least for this other veterinarian I spoke to. Was there such a thing for you in vet school?
No, there isn't. There's not. And in the school's defense, we don't, the vet schools see things that the general practitioners either are, need more guidance to figure out. But we didn't see a lot of euthanasias. You don't see that end of life care so much, unless it is a dog that's hit by a car, for example, or a dog that has a cancerous mass but we didn't see a lot of that stuff. So no, we didn't. You touched on it briefly, but it definitely. I mean, listen, all of vet school is learning after you get out of school. So you learn the basics and then you put it into practice.
Yeah. Yeah, I can imagine how that would be. I would never be able to go through vet school probably. But this part of this topic that we're talking about today is something that's touches every one of us here on the podcast and in Animal Friends and in the animal shelters here too. So moving on from what euthanasia is, let's touch on the ethical requirements of euthanasia. When a client comes to you and has a sick pet, I'm trying to give like an example. Let's just throw out there like an incurable illness,
Okay.
disease, something like cancer, something that modern medicine can't sustain the life of that pet, at least a good enhancement of quality of life. What type of conversation usually do you have with someone that has, like, name an illness that would be common for this?
Oh gosh, let's say let's say a common, this is one is probably the hardest for me. A common German Shepherd disease, which is called degenerative myelopathy. And in that, the nerves to the back legs degenerate over time. And so you know that it's happening. You can see it at the early stages. They maybe start to shuffle a little bit more in their back end. They can't pick their feet up so much, but they're not painful. And as it progresses, and so at that point, I can say, Sam, your dog has degenerative myelopathy. This is going to progress. There's nothing that we can do about it. There's no pain. They're not painful, which is a good thing, but it's going to progress. And there is not any medication that can help. There are some experimental medications that we've used in some dogs that have helped a little bit, but over time, it's going to get worse to the point where they can't walk. They're dragging their back end. Then they lose control of their bowels and their bladder. So I set them up. There is no timeline. There's no exact timeline for how slow or fast it's going to happen. Here's what you can look for, and here's when we need to have conversations about when it is time. And I think my best quality as a veterinarian is my client communication, and so I will keep in touch with these people, regularly, not every day, but maybe a couple of times a month, and just, how is Rex doing? Are you seeing any of these kinds of things? Until we can talk about put a wheelchair on a smaller dog, but on a German Shepherd, it usually is not sustainable in the house for a dog to have a wheelchair. The reason I say that is one of my that's the hardest one for me, is because usually those dogs from the hips up are 100% normal. So that's a hard one. So I try to at least give them the progression of what's going to happen and when it is going to be time that we are going to do it. And I set them up, this is going to be hard because their mind is there. Then if you have, say, a dog that has a splenic mass and is bleeding internally, then we have to have the conversation. Okay, this is what we can do. We can do surgery. We can take out this spleen. I can refer you to somebody who can talk to you about chemotherapy, or we can euthanize when the time comes. So there are different scenarios, and some are quicker than others. So the mass on the spleen, that is something that might progress quickly. The degenerative myelopathy, that one we have a little bit more time.
Yeah, that's one of the hard pieces, I feel like, when it comes to like for veterinarians and for pet owners who get a diagnosis that is a terminal diagnosis. It's going to lead to something such as what you described there, or even a cancer diagnosis.
Right.
Even at the time that they catch it, it's not like humans where we have so much more different options and treatments. And for humans, it's not always that terminal. Dogs, can you elaborate on that? Have
Well,
you
like
gotten
cancer,
advancement?
for example, there are oncologists out there, and we can do chemotherapy. The problem with chemotherapy in animals is they don't understand why they feel terrible. At least with us, we can say, listen, you're going to have this chemotherapy and you're going to feel terrible, but here's why it's happening. With animals, it's just not, you just can't communicate to them, so they don't know what's happening. And it's it's just it's the main thing for me is empathy and no judgment. Some people can't have the time and the monetary resources to do a CT scan and chemotherapy. Around here, a lot of people don't, and that's okay. That has to be okay. It has to be okay to say it's okay. It's okay if you can't go. You can't go the extra mile, so to speak. It's an individual. Everything is individual.
Yeah.
Yeah.
Yeah, I think that's actually a very good point to bring up because humans, we have health care. Most humans qualify for some form of health care. Dogs don't have that safety net. They don't have
Right.
that medical relief financially. So there's an extent of what you can do within your budget too. And not saying that that's the ultimate determining factor,
No.
but it does come into play when it's like, all right, how far do we take this?
Right.
The age of your pet, the condition, what you can afford, because even in a bad economy, you're just trying to keep your head above water yourself. Those are all these different things to balance.
So all I can do as a veterinarian is lay out all the options, and this is gold standard. Gold standard would be to take your dog to an oncologist, have a CT scan, see how advanced it is. The other thing is, taking them to an oncologist does not mean that they have to go forward with any kind of chemotherapy. Sometimes people just need to go and have the conversation. What are the chances that this dog is going to make it through? What are we looking at as far as treatments and how are they going to feel, et cetera? So this is the gold standard. But just because I'm telling you that this is the gold standard does not mean that I'm telling you that that's what needs to be done. I just need to give you all of the options. And then, like I said, you can't, whatever the owner decides is, you have to be okay with that.
Yep.
Yeah.
Yeah.
If I may interject, I work with animals as far as behavior issues, and you're dealing with the people. It's sometimes not black and white. I have had clients that looked at me and says, "There's no way I'm going to put this dog down. The dog's suffering. It's falling down right in front of the people." But they just can't, they don't have it in their heart to put their dog to sleep. And they're looking sometimes to me for an answer. And I don't really have one except the small advice of this dog has been looking for you to do the right thing for him his whole life. And this is just one last time he's expecting you to help him out to do the right thing. And it helps a little bit, but then again, God bless you for what you do, because I've been in the same room with you to put my dogs down, and you were fantastic.
Well, thank you.
I'll never forget you for that. But it's tough, it's like I said, it's not black and white. Sometimes it's all emotions that you're dealing with, and they're not going to be reasonable. This is more than they can stand to put down a loved one. To them, it's like putting down a child. How do I get past that? And one of the things you just said is that was great was we don't judge, and you have to convey that to the client that you don't judge. So if you're not going to do the gold standard, you're going to do whatever is the right thing to do. And as long as the customer or the client can handle that, uh, you're pretty far off. You're ahead of the game.
Mm-hmm.
I think one of the things I've been thinking about is I think there's a part of the client's experience. It's about your former experience as well, because like you were saying, Tom, Dr. Wolf, also about a year ago, I had to put down my German Shepherd, had a splenic mass. And prior to owning my German Shepherd, we had another dog years before who also had a splenic mass. We did the surgery, and the dog only lived a couple of weeks. And I think that experience informed what I would do this next time. And so I think thinking about, what's right for your particular dog. But I also think that past experience really informed how I handled that next experience.
And to what you're saying and what Tom had said when he said people hang on, that the dog is literally falling. I think most people will only make that mistake once, and they will say from then on, I let this dog go. I let my last dog go too long, but I didn't realize it until afterwards,
Right.
and I'm not going to let that happen again. Yeah.
If I can convey a short story, I had to take I shouldn't be so prejudiced, but one of my favorite dogs was a hunting dog. And we had a great time in the pheasant fields for years. But I took her in because she wasn't acting right, and it was diagnosed her. She's just loaded with cancer. And coincidentally, hunting season was only 2 days away. That was Thursday, and hunting season was going to be Saturday. And I asked Liz, can I just keep her around for a couple of days, because let her go hunting one more time. And it was kind of the right thing to do, because I got to be honest, she was not all that into it as much as I would have thought she would have been, but she tried. She so tried. So, but I had already that Thursday made the appointment with you for Sunday or Saturday afternoon. So we went hunting, and then we went to the veterinary office, and Perry Vet was incredible, the way they handled that dog and the way they handled me, because it was a tough place to be.
Mm-hmm.
We do, I'm going off topic a little bit here, not off topic, but we do have a comfort room now that is two things. One is we have a comfort room that has a door just right to outside, so that people don't have to go through the clinic, and it's the girls have made it so comfortable in there, and it makes a world of difference for people now. It's not quite as cold as sterile and a lot it just makes a huge difference. That, and I don't know if I should bring this up now or not, but I've started doing at-home euthanasias, which is something I've kind of been passionate about for about 5 years, but we didn't have enough in-the-house veterinarians in order for me to go out and do them. And so I am just doing it on Friday afternoons now. But it is the people that we've done it for are just, it actually started because a friend of mine had several dogs that I put to sleep at his home. And it was so important to him that they were done at his home. And I saw how relaxed he was, how relaxed the dogs were, and I thought, this is something that we as a big practice need to offer, and it has really, in a weird way, filled my cup that I've been able to do this for some people.
Yeah, that is a blessing. That really is. You're able to do something like that, because I could just imagine. Well, I know personally too, when you bring a dog into a vet office, they're not used to the vet environment.
No.
Sometimes for even just your typical wellness appointments, they need to be sedated, depending
or
on
a
the dog.
cat, having to shove a cat into a carrier and take it in, and it just is, the whole thing is just, we make it as comfortable as it can be, and honestly, I think 99% of the time it is, but still they're in their environment, and so yeah, it really has been something that has fulfilled me, even though seems like an odd thing to fulfill you. It just is. That end of life care is
Mhm.
just such an important thing. As I get, I don't know, is it me getting softer as I get older? I'm not sure what it is, but
No, it is. It's a step in the process of life, and as us as pet owners that we all have to go through, and to make it as bearable as possible, as stressless as possible.
yeah.
It's no euthanasia is ever going to be easy. No matter how many pets you've had, no matter how many times you've gone through it. It I always hear from people, because I work part-time at PeriVet too, and when they come out of the room, be like, I thought this would be easier since the last pet, and it never is.
No, I thought I'd be prepared, and you're never
Yep.
prepared.
No.
I think also part of it, I had a dog that my favorite dog. Actually, he's kind of been. I don't know. There's another one I have that's a favorite now, but he had seizures, and he was about 12 years old, and he just had seizure after seizure one time at our house, and I was able to put him in the car, take him up to the clinic, and euthanize him at that point. And I thought to myself, as I was driving up, I thought, people that don't work here have to call the clinic, get an okay, and they're feeling like I'm feeling right now. And I just have been very acutely aware since that happened to me, about how when they're scheduled ahead of time like you did, then it's not quite so bad. But when something is happening and they just want to take care of their animal, and they've got to go through all the steps, which is nobody's fault. It's just life. But it does make me acutely aware of how unfortunate that can be. Yeah.
A
Yeah.
lot of trauma.
It's making me think too. I'm a parent, and I still have two kids, 17 and 14. And this past dog, our dog Cash, was the first experience they had with euthanasia. And they decided to be in the room, and it led to a lot of conversations about life and death, and as a
Conversation.
very
Right?
very
Right.
good
Yeah.
conversations. And I did not. I gave them the option to be in the room or not, and they both chose to. But I think for as difficult of a time as it was, I do think it was a very it opened that door to conversations around sometimes doing the right thing is very hard. And I'm just wondering your thoughts around some people choose to be with their pet, some people choose not to, and do you have thoughts around that and sort of that dynamic of people? So we talked about place, but also like the people in the room.
So again, I would say by and large, people want to be with them, which I think has changed. So much of veterinary medicine has changed in the last 30 years, but that's one of them. Just the perception of people and their pets. I mean, their pets are you see people. There are people that take their animals everywhere with them now, which is great. I mean, more restaurants and stores and that kind of stuff. So pets have become more a part of our family in the last 30 years than I would have ever thought. So most of the time, people, if they ask me if I think they should, I always say yes, because I do think it's important that you are there with them, and that they have a familiar face. I will tell you though, our employees are the second best thing to the owner, and our girls in the back are so empathetic and so loving that even if somebody says no, they don't want to be with them, I cannot say enough great things about our employees across the board. They will take over the role of the owner, so to speak. I also think though the process of the euthanasia has really evolved over the years, and how we're doing it right now is, to me, by far the best that it's ever done. So we give an injection in the muscle that sometimes stings, sometimes doesn't. We try to make it so that it doesn't sting, but that will be the last thing that they feel. And then they're so sedate, but they still can hear you. They're still conscious, but they're not feeling anything. And it just it's a smooth transition as can be. But I've had a lot of questions recently from people about, like, do you think animals have souls? And I think, how could you live with this animal that is like your best friend for 13 years and not think, of course it does. So, yeah, I think it's important for them to be there. However, if there are people that can't be there, then that's fine too. I also, it's interesting because it's an interesting question. I used to think that I didn't think that kids should be there, but I do. I think probably because our procedure has changed so much that the animals don't fight at all, that I think it's important that kids be there also to know that it's okay. This was okay. This was a hard decision, but it's okay. It was responsible. So, yeah. And people bring their other pets too sometimes. Most of the time, the other pets don't really care so much, but it's important for the people. And if that's what's important for them, then I'm all for it.
Thank you.
Okay. Well, before we continue on, we have to take a quick commercial break, so stay tuned. For over 30 years, the residents of Silver Springs, New York, and all surrounding areas have had the pleasure of indulging in deliciously crafted pizza from Pizza Depot. This small business pizza shop has become a staple in the area, known for its hospitality and excellent comfort food. They have a variety of popular foods, such as subs, paninis, burgers, chicken fingers, wings, salads, and of course, pizza. Pizza Depot has partnered with Animal Friends of Wyoming County in supporting our mission of sponsoring our shelter dogs. Thanks to Lisa and her team, we have been able to sponsor more successful adoptions. So next time you have a hankering for good pizza, consider Pizza Depot in Silver Springs, New York. Their prices are very affordable and food will always bring a smile to your face. Their address is 130 North Main Street, Silver Springs, New York, 14550. Their phone number is 585-493-5699. That's 585-493-5699. When you place your order, tell them Animal Friends of Wyoming County sent you. Pizza Depot. My mouth is already watering. All right. Thank you, everyone, for coming back and joining us again. We are talking right now about the humane process of how a pet nowadays is euthanized. And I think it'll probably be wise just to put it in retrospect of what it used to be like. How has medicine evolved since you've become a veterinarian, and this humane process of euthanasia evolved since you started?
Well, I mean, it has always been humane. It's just more been, so it used to be that we would just give this injection, which is an overdose of anesthetic, just give it in the vein, and that was it. And that worked fine. That worked fine, except for when you have a cat that, doesn't want to lay still and is trying to bite you, and or a dog that's trying to fight with you. So then we started putting an IV catheter in. The problem with that was that we would take the animal out of the room, put an IV catheter, and then bring them in. Same thing though, then we would give the injection and it would go in an IV, so then the animal wouldn't struggle quite as much. Occasionally we still would have some that struggle. And the people didn't really love when we would take them out of the room, which I understand. People like, especially at the very end, they like to be with them the whole time. So we've been doing it this way for probably the past 10 years. And it is, I don't know that we'll ever, never say never, but I don't know that we'll ever change from this, because it is, once you give the injection, and very rarely do I get animals that fight with that, they go to sleep and then no struggle after that, which is what we want. Nobody wants to remember a struggle at the end. Also, when they struggle, then people think, well, maybe I'm making the wrong decision. But struggling doesn't mean that they're in any better shape. But
yeah. So the process has basically been similar. It's just might be a little more sedated is the best way to say it, or how
right, and more a little calmer all across the board for sure. But the same procedure, just a little bit different.
Yeah. I wonder how, to put in perspective for our audience that may not be from country living, so to speak, and I'm not putting down anybody. I just wanted to say that first and foremost. But the way we euthanize a companion animal is a little bit different than how they would do it on the farm, especially back in the older days. Nowadays, we have a lot more regulation, a lot more of a strict control of these are companion animals. By law, you need to respect their quality of life even at the end of their life. But there was a time, unfortunately, that there were the farm dogs that were taken out back if the time came and things
Yes.
like that. From your perspective, how have you seen that in a country living such as Wyoming County? Has that changed too? Has that not been
Honestly,
an issue?
I have not really been exposed to so you honestly a bullet at close range is still considered a humane form of anesthesia, like for cattle, etc. I could never do it. I could never shoot a gun, period. But I could never do that. But I really have not been exposed to that much. You they did teach us, this is one thing in vet school that they taught us. So I always have the right to say no, I won't euthanize an animal. And uh they taught us that if you say that, then the people could, get in their car and throw their animal out the window. But I don't think that ever really happens. People don't really do that. They just go somewhere else and
Mhm.
somebody else does it. But I do always have the right to say no, I'm not going to do it.
Mhm.
But again, it comes back to the same no judgment and respect of the people. I have not had to do that too often. I can think of a couple of instances. The most recent one was a 1-year-old dog that was having seizures, and the people wanted to euthanize instead of treating. And I said, I'm not going to do that. This is a treatable disease. It's not super expensive to treat. It is easy to treat. If you don't want to, here are our options. We treat the animal, or you sign the animal over to me and I will find a home. And they treated it, and I still see it to this day, and it's probably 6 years old now. And the people, every time I see them, they say, oh, I'm so glad we didn't put him to sleep. So sometimes it's really, a lot of my job comes down to education. You just have to educate people, whether it's a disease that their animal has and how it's going to progress, what is happening in the body when this is going on. It just really comes down to education.
Mhm. Yeah. Yeah, it's not an easy decision to make, and I know that this is it's a hard topic really to dive into, to be honest. We're used to on this podcast talking about things like pet obesity, or I just got done doing one on agriculture, just a general awareness of it and things like that. And you get to this subject, which is a very important topic for us to talk about and to share with our audience and to educate, to your point there on. But it, even just talking about it in layman's terms is not easy to
Yeah.
do.
Right. I mean, sure, I want to talk about the animal. I'd like to sit here and talk about the animals that I've saved over the years, because there are one or two of them also. But this is reality. It's reality, and we have made this reality as smooth of a transition as possible.
Mhm.
And that's all we can ask for. I will tell you, I get more thank you notes and cards and flowers from people whose animals I put down than anything, because that is it is so important to make that transition smooth, and to to communicate with the people of what's going to happen and what we're going to expect, and help them along. I think help them along. A lot of times I will have people that I'll diagnose something, and they will say, how are we going to know when it's time? And I say, that's my job. That is my job, is to help you, let you know when it's time. And that's, is it my favorite part of the job? No, but it is part of the job, and it's part of the job that I take seriously.
Yep. Yeah, and it goes back to Tom's point of us as pet owners. We're in such an emotional wreck when we get bad diagnosis, or we know it's coming close to the time, but we need that voice of reason, someone that still advocates for the pet to say, hey, it has gotten to that point now. And it's hard for us. We sometimes selfishly want to just hang on to those precious last moments that we can, no matter what we can get. But we also, when we are more clear-minded and we're talking and communicating with our veterinarians, we know when, okay, this is what's best for the pet.
Right.
And that is a hard decision for humans to emotionally get to, because also to what Thomas said earlier, society has changed even for how we perceive our pets. My mom has talked about before. She's the animal control officer of Wyoming County, and she's talked
For how
about
many years, Sam?
for how many years she's been doing it since '97, actually.
Yeah.
Yeah, so it the whole thought has changed around
Yes.
companion animals
Absolutely.
for that long, for almost 30 years now. It's just this revolution in the companion animal and small animal world that we look at them as kids. We look at them not as just the neighborhood dog, but as part of that family's extension. And so when you societally or socially, I mean, put that in your brain, it makes these decisions even harder for us to do. And
But ultimately, they are our pets, and ultimately, we are responsible as humans for their well-being. Yeah.
It's interesting the way just going back to my kids for a second. I was trying to teach them also. It's a piece of being a pet owner.
Mhm.
It's the not fun piece, to like cleaning up after your dog, and like we always say, trying to teach people about responsible pet ownership. But I think when you have a clear mind talking about this topic, not when you're in the situation, so you kind of know what to expect. And you also think about it too as you get different animals, whether you're adopting an animal or caring for an animal. I think it's just a valid point of thinking about being a pet owner as, how will I feed this dog? How I, make sure that I can pay their vet bills. So before you get an animal, I do think it's important that you think about all of these things, even the not so fun things that come along with
Right.
it.
Absolutely.
yeah. Yeah, there's good things about being a pet owner, and there's some things that are they're inevitable, they're sad, but it's part of life.
Well, and the good things 110% outweigh the
Oh, absolutely.
110%.
Yeah. And I do think that teaching kids in the manner that you did is very wise to do, because as they're learning and they're growing and they're developing, they see what the real world to a degree is like when you get older, that these tough decisions no one wants to make but has to make. And so it's a great life lesson to give your kids as a gift too.
Absolutely.
So we've talked about how the procedure's performed, aftercare preparations, things like that. I know, just as you've mentioned it before, PeriVet offers different things like cremations and things of that nature. Could you walk through the different options usually the pet owners will have afterwards?
Sure. So a lot of people like to that have the room will bury the pet right at their home, and if that is very common. It's very common also to have a private cremation with ashes returned, and we work with a pet crematorium they're great. They're up in Batavia, and they really do a great job. In fact, they would allow any private owner to bring an animal up there almost any time. As long as they are there, they will do it. And it's a common question, am I for sure going to get my pet's ashes returned? And we have been up there several times to tour the place, and they really do a great job. And the answer is yes, it's going to be your own pets. And you can also have them cremated in a group cremation if you don't want the ashes returned, and that's fine too. They come in, they come in a cute little tin, but there are also a lot of different options as far as receptacles that you can put them in to display. And some people display them, and sometimes some people put them in a garden. And so it's those are the three things, and all of them are good options. All of them are good options.
Yeah, it's giving your pet that final resting place now, and it's not everyone would have the land or the property to be able to bury at home if you live in an apartment or things of that nature, but they do a really excellent job.
They do. They're good. They're good to us. They're good to the animals. I really like them.
Yep. Yeah. And then as far as the emotional support aspect of this, I only talk about my personal experience whenever I've had to bring a dog in to be euthanized. For me personally, the best emotional support I get after the procedure is just that hug from the veterinarian.
Yeah.
That reassurance. I remember you giving me one specifically, but it's we make the tough decisions, and it always will weigh on us for a brief time, but things knowing that you did the right decision at the end of the day is that extra comfort of knowing that you didn't let an animal suffer.
Well, and I think a common saying is, I don't want to play God. I feel like I'm playing God, and people will always say, I'm just, I just hope they just pass away at home, which is what a lot of people hope for, and unfortunately does not happen as often as people would like it to. But I feel like I'm playing God, and I understand that aspect of it. However, we like we have talked about before, we are ultimately responsible, and to me it is a gift that we are able to do that. It would be difficult for me to be in human medicine. It's a gift that we are able to end suffering when it is necessary.
Mm-hmm. Yeah. So I guess moving on from the humane process to more of the legal awareness of things. We touched upon this a little bit in your educational video, which I hope that our audience takes a moment to go to our YouTube or Rumble page to view it, because it is very informative on the process and everything that we're talking about here. It really summarizes it and sums it up in that video. There are legal implications to proper euthanizing of a dog, because you do deal with animal cruelty, and if it's not done humanely and properly. I, as an animal control officer, can tell you of the different animal cruelty cases that I have to be a part of and unfortunately witness or give a testimony to or take the dog in. We've had some that come through the animal shelter within the past year or so that I've been around full time at the animal shelter to witness. Not that this has anything to do with euthanasia, but there is a process that's supposed to take place if you've come to that decision of my pet is no longer at the right quality of life. I encourage everyone, when you get to that point or you have questions about that, always go to your veterinarian regarding it. Can you speak to any aspect of that when it comes to the humane euthanizing that's legally and a legal aspect of things, or?
I guess really the only legal things would be really dealing with you guys, and so we don't do so much of the legal aspect. You are more in charge of that, as far as animals that you have picked up that are strays, that you the number of days you've got to keep them here. I suppose part of it, the behavioral euthanasia is part that is could be difficult, I suppose, as far as the legal aspects of it. And I behavioral euthanasia is difficult. There are a lot of avenues you can go through before you have to decide on that. One is like a behavioral trainer, like Tom Purcell is a behavior trainer. He works with dogs in, I don't know, all aspects of behavior training. Right?
Straighten them right out.
That's right. Mm-hmm.
But I'm kind of prejudiced that way too. I think all dogs can be rehabbed back into being normal, unless they're mentally ill. And just like humans or any other species, you can find mental illness once in a while, but rare. I work with a lot of dogs that are assigned to me by the court, because they did something stupid and they shoot up the next door neighbor kind of thing. But this is all stuff as far as behavior. I don't want to see them put down, because they can be rehabilitated. And I can't recall anything that wasn't a success. Something as simple as I recall a dog. I got a call from a veterinarian who said, "Can I pick your brain? I just worked with a dog's ears, and when it got home, it ran up into the closet, and it's been hiding up there. How do we get it out of the closet?" Do you remember that, Dr. Wolf?
I don't remember.
I said, okay, can I have their phone number? And I went over to the house, and the dog said, okay, I was just nervous for a little while. I'm fine now, And then the dog was great, but it was a funny call. I always remember. The dog, I cleaned his ears, and he went home, and he hides in the closet upstairs, and it won't come out. I wish all my calls were that simple.
That easy.
Yeah, but as far as behavior euthanizing, that's a tough one.
It's a tough one.
It's a tough one. If you got to have a very good, dedicated owner too. If you're going to try and get a dog out of a place where he thinks he's biting, and by the way, as far as I'm concerned, 99.9% of all bites are fear. So you gotta work with this dog's fear factor to get this dog to have a nice normal life. I'm thinking of Luke. We had a dog that lived here for a year. Well, he would normally be put down. He was a lunatic. When I met him, he'd take your hand off if you got close. Subsequently, he lived with me for about 10 years, and that was a really tough departure then. But yeah, behavior euthanizing, that's just a tough one. I think they could be rehabbed, but I'm not always right.
It's we're gonna have to agree to disagree a little bit on this, because I worry about kids in households that have. I had one not long ago that they had a 2-year-old. The dog had gone after the 2-year-old. So then the people and the dog was like 10 or 11 years old, were putting it in another room, and the woman was pregnant again. And she said, she just said, I don't know what to do. And, to rehome a dog that has gone after a 2-year-old there's a responsibility on me to not let something like that happen. And there are a lot of different scenarios. I mean, you can say it needs to go to a home that doesn't have any kids, etc. But you're right. What it comes down to is the owner. Yeah, the owner wanting to put in the time.
And also, we're going to agree to agree,
Okay.
because there are just some times where this is just plain old dangerous.
Yes.
I can't say, well, let's save the dog and not worry about the 2-year-old.
Right. Right.
We can't go there. I've only ever, believe it or not, with the large number of dogs I've worked with, only been bit ever once.
Yeah.
And that was a simple case that the dog had claimed the mom, bit the husband, bit both kids, and she was a little weird. She was like, you guys better be careful. This dog loves me. It'll bite you. She's telling this to her family. So I had to be honest with her. I said, with this dog, you're gonna have a problem. This dog's going to hurt somebody really bad someday. And I hate to be prophetic, but it did attack a 4-year-old. And she finally put the dog down, because I'm not going to tell you whether to put your dog down or not, but I am going to tell you that you have a problem and what the problem is. And hopefully you're smart enough. I had another behavior problem where long story short, they didn't tell me the truth to get me there, but I found out that the wife had multiple sclerosis, and the dog decided it was a big Rottweiler. It was time to take her out of the pack. And he attacked her, and he grabbed her head and shook her to kill her. And now again, it's not my job to tell you should put this dog down, but it is my job to tell you got a problem.
Yeah.
I got a severe problem. I never heard from those people again. I don't know what they did.
Behavior euthanasia is a very, very small part. We very infrequently do them, and when we do, we really hate it. But again, you also have to take responsibility when you have a dangerous dog.
Yep.
Yeah.
The owner has to take the responsibility.
Right.
Well, I'm glad you both touched upon a couple of things that is definitely something for me as animal control have been very hard and pressing for me to have to deal with. And my mom could be able to elaborate a lot more on this than I can probably. But because we are an animal shelter that takes in stray dogs, we don't always know where they come from or why they're stray to begin with. We like to think that, they just got away from their owner, and we're just hoping that they find them through our Facebook page and they're reunited. But as a large percentage of the time, that, and most of it's pure speculation, but we find out eventually why they were dumped off. They either had behavior issues, they were aggressive, they were in a terminal condition such as kidney failure or renal failure. We have seen that far too often, where instead of taking on the ownership of doing what's right by your pet and either treating it or you putting them down with a veterinarian, they just leave it off the side of the road. And animal control then has to take on the ownership responsibility of what do we do with this dog, especially if it's a dog that we do know has gone after one of our volunteers or is not safe around kids aggressively. You walk by its pen, and we like to call it a cage gangster type thing, where it's just going right after you. And we're like, we do work with them here, but we also aren't animal behavioralists. We are blessed that we have Tom and someone else on our board, Kelly, that does dog training too, that's able to come in and volunteer and work with some of our dogs. But at the end of the day, we have a responsibility as animal control of making sure that the public is safe. Making sure that if we adopt a dog out, that we know what home it's going into that is the right fit for that home. And even then, we could have all the check boxes perfectly aligned and something still happen. So,
But in your defense, that happens very infrequently. You guys are very, very good. You do an outstanding job of putting owners and animals together. I think we as humans just remember the bad things.
mm-hmm.
But you do a lot more adopting out than you do euthanizing. Yeah.
Yes, we do.
A huge percentage. I think we were talking about that the other day, the percentage that I think I was with your mom, and it was a very small percent this year of animals that had to be put down versus animals that were like, I think less than 1%. So
yes, yeah. We are
That's
deemed
good.
a no-kill shelter. We actually got an award from I believe, Best Friends of something. Sorry, I don't know the name on the top of my head, but we actually have this plaque that says we are a no-kill shelter, which is very comforting for us to see because, like you said, we keep those memories with us on a dog that's been here for months, that we try working hard with to get it the right home. And then it still is a danger, or it has to come back because it did attack someone. And we have to take that responsibility of we can't let that happen.
yeah. It's a big responsibility, and it's something that none of us take lightly.
Exactly. Yes, and I want people to know that if there's ever a time where a dog that's at the shelter and we don't have a policy here on how long they have to be here. Luke is a good example. We had him for a year, if not a little more than that, before it was just the right home for him was found. We do keep dogs here as long as we can be able to work with them and find them the right home. The right home will come along, but it's those issues that we can't fix that is part of our responsibility. We have to fix in some way.
Right.
Yeah. So that's for me the hardest part of the subject to touch upon is seeing the dogs that come in here, and instinctively, if this dog doesn't turn around and we can adopt this dog out, there's nothing else we can do, because it's not good for them to live here that long just because we don't want to go through that part of the animal ownership. So, yeah. Hard stuff to talk about, guys. Before we move on to the next part of the podcast, we're going to take a quick commercial break.
Since 1981, Daryl's Pizzeria has been serving the town of Perry, New York with delicious and amazing pizza, wings, and a variety of other complimentary dishes. Whether you are picking up in person or utilizing their local delivery service, you can always expect friendly and passionate faces from their staff. Aside from your traditional trademark food items, Daryl's also provides ice cream from Yummies in Warsaw, New York, as well as daily specials. Also, you can order your food online through their website too. Daryl's Pizzeria has been a constant sponsor of Animal Friends by helping us sell chocolate bars and calendars. Thanks to their sponsorship, we can further our education initiative and make more successful adoptions possible. Order from them today in person at 163 South Main Street, Perry, New York, 14530. Order online at darylspizzeria.com or call them at 585-237-2113. That's 585-237-2113 or darylspizzeria.com.
All right, welcome back, everyone, to the CHOW Podcast. We have our guest, Dr. Liz Wolf, here to talk about the sensitive but yet important topic of pet euthanasia. And we are at the portion of our podcast where we have questions, and hopefully we have some answers that can help anyone who's interested, or you may have questions yourself. If you do have a question for any of us on the podcast, please tune into our social media where we try to announce when our guests are going to come on now. And we have an email address, chowafwc@gmail.com, where you can submit your questions. And even if there's not a topic that's coming up down the plate, please submit your questions because we'll keep them on hand and we can use them in our future video when we are talking about that topic. So,
Great.
without
Let's
further
bring it on.
ado, yes, Jesse, why don't you start off with the first question?
So this question comes from Tom in Arcade. My dog has been dealing with advanced kidney failure, and her health has been declining. How do I know if her quality of life is so diminished that euthanasia is the most humane option?
Kidney failure is difficult because the kidneys do not regenerate. So they just continue to degenerate over time. So I don't know how in depth you want me to go. Can I just keep going? Okay.
Yeah.
So if we have kidney failure, then we're put on dialysis, and they put a port in us, and we start once a week, and then maybe several times a week, and you go in, they hook you up, they dialyze you, which means they just put fluids in. Your kidneys recycle this fluid. The kidneys in the bladder work, and it just is it's just a refreshing of the kidneys. And then people or dogs, we can do that to animals, feel better afterwards. So kidney disease, there's a couple things you can do. You can push fluids. We can't keep animals in the hospital. We can't keep cats and dogs in the hospital once a week for 24 hours to try to dialyze their kidneys. It's just not fair to them. So people can do fluids at home under the skin. And also there are some diets that are specific to try to slow down the progression of kidney disease. So those are two of the things that you can do with bad kidneys. But then there becomes a time. Kidney disease itself is not painful. Again, a blessing. But the kidney enzymes that get high in the blood make the animals sick to their stomach, and so they don't want to eat, and we don't want them to starve. So when they stop eating, and that's pretty much the biggest sign is when they stop eating and start to lose weight. That's the best sign.
Mm-hmm. Tom, do you have a question?
I do. This might be a little out of sequence, and we're doing that for a reason. But I do have a question from Alex and Perry. He says, I've seen a lot of pets in severe pain, and it makes me question what's best for them. Is euthanizing the only option for ending a pet suffering? Or are there some other ways to manage their pain before making that decision?
That's a great question. There are a lot of options in managing pain now. There are a lot of options in managing pain. Some that you can start or that you would want to start early that I think are good for any dog. Dasaquin is a good joint supplement that does not cause any secondary side effects. Fatty acids are great for joints. And then you can get to things that are a little heavier, like Novox, which is a non-steroidal anti-inflammatory that can cause liver and or kidney issues if given long-term. Galliprant is another non-steroidal anti-inflammatory. There is a new, keeping on with that, gabapentin is a neurogenic pain medication that kind of sometimes works, sometimes does not. Tramadol. So pain relief can be a multimodal approach. More talking about like dogs with osteosarcoma, so bone cancer. We delve more into this multimodal approach. CBD is another thing that's really big right now. You got to be real careful because some of the CBDs that you can get are not as effective. We carry one from Elevet that is really a great product, and a lot of people think that it helps a lot to lessen pain and lessen anxiety. There is a newer medication that is a monoclonal antibody, so it works at nerve endings, and it's called Librela. Really good for chronic arthritis. It's an injection that's given once a month. I have my older dog on it, and I give it to her, and about 2 days later, you think that she has grown wings. She feels so good. So yeah, there are a lot of options with pain management before euthanasia.
Now, this injection that you're giving to your girl, is it expensive?
It's expensive. Yeah, it's about, depending on the size, medium 60-pound dog, it's about $70 a month, but works. And they have used it in Canada for years, in Europe for years, and they say that it has removed the need for non-steroidal anti-inflammatories. I actually still give mine Novox once a day because I found she needed both. But yeah, it's expensive, but it works.
Thank you for that question. A question I have here is Sally from Silver Springs writes in, when my dog was put down, it was a very emotional experience for my family. Do veterinarians offer support for grieving pet owners after euthanasia, and how can we cope with the loss of a pet?
I think we each have our individual strengths as far as emotional support. I am always happy to talk to somebody on the phone or in person, whatever they need. We don't have somebody dedicated for that. I have actually brought that up before, that I think it would be good to have somebody that was available through the clinic as kind of a grief counselor. That hasn't happened yet. I don't know if that would ever come to fruition or not. Not everybody believes in that as much as I do. But I do think that all of us are available to talk about it if need be. And there are some people that need to even a week, a month later still wonder if they made the right decision. And that's fine. Just call us and we're there for you. So yes, there is emotional support, but not nobody other than us veterinarians. But we do a pretty good job, I think.
Yep, you do.
So we talked a little bit about this, but this is more of a general question. So I'm curious your thoughts. This is a question from Jennifer in Warsaw. I'm really struggling with the idea of euthanasia for my dog. How do I know when it's the time to consider this decision? And is there a specific sign that tells me it's the right time?
There is not a specific sign because it differs from disease to disease or age. There are so many factors that are involved, and that is our job as the veterinarians to help with that process. And so if anybody thinks that it's time, and sometimes they come in and we say, I think it is time. And sometimes they are surprised that there are things that we can do. In fact, that's to Tom's question. I think that is probably the most common thing. Well, geez, let's just try this pain medication for a month or 2 weeks. And if you don't think that it works, then let's have this conversation again. And so that there are, it's an individual basis, but that's what we're here for, is to help with that.
Okay, I have a question here from Sandra and Bliss, and we touched on it a little bit, but at the end of this question, you'll understand why we have it. What happens after euthanasia? How do we choose between options like home burial or cremation? And how does the process work for handling my pet's remains?
So we always do, after euthanasia, the people can stay in as long as they want to. Some people want to get right out. Some people want to have a few minutes. And we have a system that they can ring a bell so we know when to go in there, so we don't have to keep going in and checking on them and interrupting them. Then we bring the animal back and we make paw prints and nose prints, and if people want a lock of hair, so that they have something to remember the animal by. And I think most people really, really like that. And then as far as decision what to do with the body, like we had talked about before, some people can bury them at home. Some people just can't, and that's okay. And some people can and choose not to. And so we are very respectful with the bodies as far as getting them packaged up, and then they get picked up by the crematorium and delivered later. But we are very respectful with the bodies and treat them as if they were our own pets, for sure.
Yeah. Yes, I definitely can attest to that too. That it's definitely handled with care. So, question, Christopher from Perry submitted a question. If my dog is facing severe health problems, but I am unsure about euthanasia, should I seek a second opinion from another vet to help me make the best decision?
I think second opinions, I respect second opinions on everything. If you don't feel like the answer you got is, if you don't feel comfortable with the answer you got, whether we have so many veterinarians, and there are going to be some that some people don't click with. And that's okay. There is nothing wrong ever with getting a second opinion. There's nothing ever wrong with that. I think it's great. And if, in my case, if there's something that I've told you that you go to somebody else and has told you differently, by all means, come back and let me know. I mean, I'm always learning. I don't know close to everything that I would like to know. But yeah, I think second opinions, if the individual feels as if it does not feel comfortable with the information they're told, yeah, go ahead, get a second opinion. We have a lot of really great veterinary clinics in this area, which we're very fortunate. There's not a clinic around that I could say anything bad about. We're all in it for the same reasons, and we all respect each other's opinions. So, go to York or go to Corfu or, go wherever you want and get a second opinion, if that's how you feel.
Mm-hmm.
Yeah.
One of the things that I can attest to, being involved in Perry Vet and working with Perry Vet, that I love seeing is the collaboration I see with doctors too.
Mm-hmm.
If even a doctor at the vet clinic is questioning a diagnosis or wants to get a second opinion, they themselves can seek a colleague and say, hey, can you take a look at this for me? Can you look at this blood work? What are your thoughts too? So I know
that's true, Sam.
Yeah.
You can even get a second opinion within our clinic. You're right about that. And we all have different personalities. And like I said before, we all have strengths and weaknesses. And there are some people that you're going to really click with, and others not so much. And that's okay. So yeah, I think you need to, an individual needs to do what they are comfortable with.
And that's one thing I value about veterinarians, especially when I see a good vet, is that if they don't know something, they go right to another colleague and say, you have more experience in this, or can you help me out with this? And that's one of the qualities of Perry Vet that I appreciate a lot, especially when you're getting a new diagnosis. Be like, I want to get this absolutely right before I go tell the client this. So it's very good to have that.
Yeah, we're fortunate. We are fortunate.
Yeah. All right. Well, I guess, do you have another question?
No, I feel like the ones that are on here we've covered.
Yes, I feel like we've answered, from my understanding, looking at these, most of them have similar questions that we've been able to cover with the topic. So thank you so much for submitting your questions to the podcast. And thank you for Dr. Wolf for joining us.
Yes, it was
here.
my pleasure.
Thank you.
Yes. Maybe next time you come on, we'll have a different topic that's not
That's right. Let's talk about
Happy
puppies
topic.
and kittens, right?
Yes, we'll talk about birthing puppies. Something that's completely the opposite. Well, again, thank you so much for coming on.
And I'm always available. I'm just a phone call away.
Yes. Dr. Wolf has been an amazing asset to the Wyoming County Animal Shelter and to Animal Friends. Multiple times we'll be able to take a dog in, and I remember her exact words for one dog. Actually, I think, we didn't see it now, but there is a video out there, a Second Chance Stories video on our website. By the time this episode airs, it should be out there. A dog named Gambit that we filmed. That I remember taking him into the vet clinic. And he had a whole bunch of health problems, and he did not look good. He had a bad patchiness on his skin, the hair, everything. There was mats. he needed some tender love and care. And Dr. Wolf, her exact words to me were, "Can I have him for the day?" And I immediately was like, "Go right ahead." And within 24 hours, a brand new dog.
Yep.
And so
he
we're
was
very
awesome.
appreciative to the time and the dedication you put into these dogs. So
Yeah, well, it's my pleasure.
And he's a happy dog now. when we
He
get
is a
that.
happy dog.
yeah.
He was a happy dog that afternoon.
Yes. Oh my gosh, he was something. So thank you so much for coming on
Well,
board.
thank you. Thank you for inviting me.
Yes, and thank you for tuning into this episode of the CHOW Podcast. Please go and subscribe to our social media pages and like us on Facebook, follow us on Twitter, now known as X, and anywhere else you can find us. We're on Truth Social, we're on Instagram, we're all over the web. You just got to go and find us. So thank you so much for tuning in, and I hope you have a blessed day. Bye-bye.
Thank you.
Thank you for joining us on this episode of the CHOW Podcast, hosted by Animal Friends of Wyoming County. To learn more about us, visit our website at www.animalfriendsofwyco.com. And if you're interested in adopting a dog, please call the Wyoming County Animal Shelter at 585-786-8938. This has been a production of Knox Luna Films, LLC.